I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. Hi, and welcome back to The Gritty Nurse, an unfiltered conversation about healthcare, nursing, and the intersection of health politics and policy. My name is Amie, and I am The Gritty Nurse. This podcast examines hot topics in healthcare and discusses the changes that we need to see to have a more efficient, robust, and ethical healthcare system that is safe not only for the patients that we see, but also for those who work in the system as well. Sorry, no fluff here, just awesome, compassionate humans and a lot of grit. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit that subscribe button so you never miss out on any real stuff from The Gritty Nurse. So welcome, Mike, to the show. I'm so glad that now you finally had an opportunity to sit with me on a different platform. So we got to sit together at the Canadian Club, but now you're in my home. We're sitting on the Gritty Nurse podcast, and I want to really actually just continue that conversation forward because I think it was too short of a time and so much more time to dedicate to talking about, healthcare, AI, technology, nursing, all of those various different elements that really impact how care delivery is handled. So I'm so excited that you're here. But before we get started, maybe you just do a little brief intro about who you are, your background, and kind of maybe what led you to doing some of the work that you're doing today.
Yeah, well, thank you for having me. It's great to be here. I thought we hit it off when we were all suited up at the Canada Club and all serious and on stage and all that. But this is an awesome format and we can take it in all kinds of interesting directions and a topic that I know we're both passionate about. But a little bit on me. I grew up in Hamilton, Steel Town, Steel City of Canada. My parents were immigrants to Canada and I was an only child and I was the math and science geek that had sporty friends and, won the Nerd Olympics and proceeded to do fun things with rockets at NASA and AI at Microsoft back when no one cared what, or even knew what AI was. And then, made my way to Silicon Valley and got to work with the now infamous, but formerly nobody, Elon. We were all nobodies at the time and learned to build large scale technology platforms that serve millions, hundreds of millions, eventually billions of consumers. And I've kind of done that for the last 3 decades, starting out with the first search engines and the first cloud companies, an ebook platform called Kobo that had customers in 190 countries. And about 11 years ago now, I got really interested in healthcare. And I asked myself, why is it that something that is so important that we all need and increasingly we all need more of as we get older, why is it so hard to use and access and navigate? And why is it that the world of awesomeness of all the technology that's out there, why is it seemingly ignored in healthcare? And I don't mean, the incredible technology of MRIs or, all sorts of new protocols and cancer treatments, but I mean in our day-to-day lives when, our kids are not well or we're worried about an elderly patient or parent rather, or we're worried just about our own health and, managing multiple issues as we need help as we age. And my bet was that needed to change. People would demand it. People would demand a future that was very much centered on them versus the system, whatever that is. A healthcare experience that was consumer centered, personalized with data about me. And like this situation where you go to a doctor or a hospital or the clinic or the next place and they ask you the same 1,000 questions every time and like they still don't know you and they still give you a one size fits not, like that would go away and we would all be empowered with a new kind of healthcare system, a new experience, and there would be a platform for that. There would be a company, the Apple for that or the Shopify for that. And so that's what we set out to build with League is a platform that can help modernize the healthcare experience. We started here in Canada, and we now do that good work with the leading health systems and health insurers and labs and pharmacies in the US, in Canada, Australia, New Zealand, and soon Europe and the Middle East. And we touch 70 million people now, and we're just getting started. So it's really exciting. And frankly, I've never done anything this long. 11 years. I used to cringe. I'm like, no one's going to ever do anything that long in the future. And the fact is, healthcare it has nearly infinite surface area. It is hard.
It certainly does.
It's important that you cannot make mistakes like you could make mistakes in, helping someone download the wrong ebook.
Right.
More romance versus, thrillers. Getting a book, like, okay, that problem doesn't hurt anybody. You get, the next step in someone's healthcare journey wrong, and it can be a problem. So, I love the category. I'm excited to be in it, and happy to be here with you today.
Yeah, it's quite the pivot, right? I think some people, when they start in tech, they really want to stay kind of in that realm, in that area. And I think that it's because there's a lot of complexity to healthcare, right? There's a lot of nuance. There's a lot of regulation. It's very, like you said, it's not like, just we want more thrillers versus romance. We are talking about people's lives and lives that are at stake, right? I want to dig into a little bit of a personal moment or anything that was there an aha. I'm big on stories because I think stories really kind of make people understand why people make these pivots or bring value to why you're doing probably the work that you're doing with League. Was there anything in your life where that aha moment where you're like, this customer service experience in healthcare needs to change?
Yeah. So let me give you two quick ones. One was right at the very, very beginning, and I had just left my day job. I had retired from being the founder and CEO at Kobo, and I had just finished my farewell tour because we had customers around the world, and we partnered with the world's largest publishers and booksellers. And I needed to be in Los Angeles for a special event. My wife was joining me. She's flying direct from Toronto. I was flying from South Africa, from Joburg. And unfortunately, I got messed up in Frankfurt. There was some crazy security issue, and I showed up a full day late. And so imagine I'm wearing same clothes, and now I'm feeling like the pressure of the, marital pressure that I've like abandoned my wife for like a full 24 hours in LA at this thing that she was not signed up. She was only there because I was supposed to be there.
Right.
Anyway, I show up at the next available slot, the next available event in this itinerary. And it happened to be at the LA Children's Hospital. And it happened to be with a group of CEOs, a group of leaders in technology and other sectors. And this renowned pharma entrepreneur, a guy that's built like a bunch of blockbuster, biotech and pharma companies, and, has been a real innovator and, has saved countless lives with his discoveries, physician turned entrepreneur. And he told this amazing story about the future of medicine being personalized and data driven and like, designer drugs and designer therapies and stem cells. And it was just like, it was incredible. Like you couldn't walk out of that not feeling like effervescent with like positivity about the future. And I had all these ideas and I wanted to write them down, but I had no pen or paper, and my iPhone had died because I literally been, planes, trains, and automobiles to get there. I ran out to the nursing station and I started making some notes on like fill one of those forms that they have, and I stole a pen and I went back in and I asked a question and I said, Patrick, or Dr. Sunshing, this sounds incredible. I think I speak for everybody in saying like we all want to be in this future, but many of us can't get a doctor's appointment. Many of our family and our communities can't get the care that they need for even basics. How do you solve that? And he's like, oh, that's an incredibly hard problem. Nobody in healthcare is going to solve that.
Right.
That needs like someone to come in from the outside and break the system. That's a really hard problem. And he had just explained like all sorts of genetic, futuristic, amazing AI stuff. And he was calling the day-to-day of accessing and navigating and using healthcare like an impossibly hard problem.
Yeah.
So that for me was a real eye-opener. And that was like the signal, like the bat signal, like I need to go into this. Many, many years later, so I'm more than halfway into the journey, and it is hard. And, I know that many people have an experience like this where, they're dealing with, someone they're caring for. In my case, it was my father, and he got sick, and it was, he was elderly, and he had his issues, but, he was 87 and was a strong guy still, and dealing with his case, which was quite acute, and just the constant fumbling of information and what to do next, like the care protocol. I was just like, and I had at my back on my team access to like a chief medical officer from the Cleveland Clinic and members of my team at League, and access to like I had an uncanny, sophisticated team, and I was at a loss. I was like, how do people deal with this? This is and this is nothing, not to say anything negative about the hardworking, overworked, and near burnout staff, many of whom are at our best care centers. But the system was failing people like my dad, was failing people like my mom and our family. And I was like, if I did not have a reason before this, like this whole thing needs to get completely changed, and I'm going to do it.
Yeah, I really believe, Mike, that just even hearing those stories, I think there's so many people out there that are shaking their heads going, yeah, that was me. That's my experience. And even as myself, as a nurse, as a healthcare provider, that still is my experience. Like I call it a machine that doesn't work very well. It's not very efficient. There's lots of moving parts, and some parts don't speak to the other parts, and it makes it much more complex. And I think you're speaking to something that many people are feeling. People are so frustrated, right? I think that a lot of people feel powerless. I think with, the COVID-19 pandemic, a lot of people felt that, their ability to access care, their ability to make decisions, their ability to be at the forefront of, having say in how the healthcare system works. I think it was kind of an eye-opening moment for a lot of people just to say, okay, well, where do I sit when it comes to, accessing care or being that person that has to have care delivered onto them? And I think that, we need to see a system where it feels like it's designed for us versus the institutions that we walk into. And I think that's some of the work that you're doing, right? So could you maybe tell us a little bit about some of the work that you're doing, and how do we shift this power dynamic back towards the patient?
So I think whatever part of healthcare you're in, whether that's on the provider side as a clinician, or, you're in a hospital or running a hospital system, or maybe you're a payer, an insurance company, or government that is administering a system, and, making money move and making hiring or decisions. Most people are already at that place where they're like, it's not the people. The people are amazing. It's the system. The system is busted, and the economics don't work anymore. For the most part, if you look at, well, take where we live here in Ontario, we're tracking somewhere between 45 cents plus or minus of every provincial tax dollar goes to fund healthcare.
Yeah.
And it is not enough. It is not enough, right? It is falling short. And we have demands for, an increase year over year that looks like 8 or 9%. And that's not because hospital administrators are lazy or bad or, being greedy. That's them trying to make it work. And they've got, plenty of caregivers, nurses, clinicians, docs that are, on the edge or already at burnout. But the model doesn't work because there's not really much more money or any more money. And even if we had the money, we couldn't manufacture the, train, educate, prepare the clinicians to be in the system. Just, it takes time to make a nurse or a doctor.
Right. Yep.
So our view is that technology has to be a part of the solution. And generally, the different parties that we serve, they have that idea as well, that technology has to be a part of the solution. And one of the common ways, or a very simple concept is if you can leverage technology, an app or, a bot, AI, a portal, to engage people in their health, wherever they are on their health journey. If you can do that more, well, you can give them information. So health education or promotion, right? You can give them access to prevention. You can make the cost or the choice of getting an appointment or doing a thing that is good. You can just make that easy. You can lower the friction, right? Simple example. I mean, I have a family doctor and I love him, but I cannot stand the exercise of trying to get an appointment.
Yep.
And I feel like he's great. And our experience with him and his office is great, but trying to get there and get access and get, care is an exercise in futility. And so engagement with healthcare, what happens if you can 10x that? Do you get healthier people? Do you get more prevention? Do you get lower costs? Turns out you get all of the above. And it really depends, what shape it takes really depends. And one of the examples I love using is a customer of ours in the US, a major hospital system. They're in a state that has very bad, in fact, unfortunately, the worst metrics in terms of maternal and infant mortality. So more women who are expecting die during birth in their state than any other state in the US. And in fact, most other countries in the G20, which is crazy. That when I first got exposed to these stats, I couldn't believe that was true. And the same goes for infant mortality. Crazy stats. And you dig into it and you say, why? It's like peeling the onion, right? Why? It's like, well, they don't have access to care. Why? Well, many of them live in rural or suburban, whatever is in between suburban and rural. They live in care deserts. They're not assigned a primary care physician, let alone prenatal care. So 80% show up to give birth with zero prenatal care. And so we thought, working with our partner there in Baptist, we thought we're going to create a new service called Hello Pregnancy. It's really easy. Anyone can sign up and it's free. It will give you the steps. And if you don't have a device, thankfully, the Walton family behind Walmart, they supported providing devices for expectant mothers who didn't have access. But we're going to get you on that journey wherever you may live, whatever you may pay, whatever you may we're just going to get you on that journey and you're going to get care. And it turns out after the first 10, 11 months of that running, the first babies being born and first moms bringing healthy pregnancies to term, the intensive care unit rates were cut in half and are falling. And the mortality and, infant maternal mortality rates really, really started to turn around. So that's an example of technology powered by League, branded with the brand of our partner, and in this case, a very easy to understand, accessible brand in Hello Pregnancy, and a personalized health journey for every expectant mom. We use data, we use where they are, we solve getting them the care they need when they need it. And the results, guess what? Like a day in the intensive care unit costs a lot of money. And not to mention the impact on the family who is there by their family member's side and they're away from work and then they're not able to provide for their family. So there's this cascade. So the economics make sense. The human element makes sense. The healthcare system, starts to work for these expectant moms. And all of a sudden, you end up with this better situation, all because, we partnered and brought technology to bear.
Yeah, I think that's actually a really great example. Just a couple weeks back, we had Black Maternal Health Week again, because when we look at the outcomes too, the outcomes aren't always equal. So I could only imagine that state looking at now if we were to divide that by like race, class, I should say gender expression or identity, or if we were to even look at disability in these various different other intersections, that we could see how much, something like that can really improve and change. But I want to dig into another part of this. So we're talking about AI. There's a lot I've been watching and combing, the various different platforms, hearing what nurses have to say. And I think there's two sides about it. So there are some nurses that are very excited and there are nurses that are like, wait, hold on. Let's talk about this, because I think there's a fear of, surveillance, particularly in the US. There's a fear that maybe the technology won't work for them the way that they would like it to work. But I also want to ask you, because you're doing this work, so how does League's AI orchestration actually offload one administrative work into, maybe keep people keeping this person-centered modality? Yeah. How do we ensure that people are protected when we're leveraging this type of technology?
Yeah. So, at the start is this model that we just don't have enough care and also caregivers to take care of what our population needs.
Right.
And I don't know anybody that necessarily wants to pay more taxes. We don't have enough to fund schools and other things. And we fund about half of all of our dollars go into healthcare today.
Healthcare, yeah.
So, maybe we can find a bit more money, but even if we did, we just don't have the caregivers. And so there's this gap. And the thing we know about gaps in healthcare, the longer they exist, the more difficult the healthcare situation for an individual becomes later. And
yes.
Of course, with difficulty comes another human societal impacts that just everything just erupts. It just becomes way more intense versus if you could just get someone into the care that they need. So
right.
Part of our thinking with technology period is we can solve some of those problems by perhaps introducing other kinds of people that can provide care. So other trained professionals like nurses and nurse practitioners, pharmacists. We've had the beginning of legislation that says, okay, a pharmacist can do some jobs that maybe before they couldn't do, like they can give a vaccine or they can take your blood pressure a bunch of times and put you on a hypertension protocol and maybe prescribe. So that's one way of dealing with the load, right? Supply and demand. There's just way too much demand, not enough supply. And some of those jobs they're more transactional. There's probably better places to take care of them, like your local pharmacy, which, everybody lives within a few kilometers of one. And that can free up, clinicians, nurses, doctors' time to do other higher value, let's say higher acuity tasks.
Right.
Now, AI is already helping make some more time in that. I've watched The Pit, which I totally negged on for a while because my wife was watching it without me mainly. Then I started watching it and I feel like I personally traumatized and actually
understandable.
And I thought I was traumatized until I went to another ER yesterday, and I had this full walkthrough of this ER, and I was like, whoa, okay.
Yep.
And all this. But anyhow, scribing technologies are helping, but they're not perfect yet.
Right.
They'll get better, but they take up, or give back some time to clinicians. And our thinking more broadly is, okay, there's still a gap. So if I take away some of the administrative stuff, if I take away stuff that frankly can be done by other people, and so I reserve the time and the energy and the great education that these clinicians have in hospital for, higher acuity, higher value tasks or cases, there's still not enough time. It's still not enough people. So that's where we think if you just take all of the sort of healthcare things we do as humans and where we need care, you just kind of disaggregate it and you can say, all right, well, some of these things for sure other clinicians could do, like pharmacists, and maybe they have capacity because the dispensing part of the pharmacy is becoming more centralized and more, automated. But there's going to be a part that software can do. and software can
Yes.
help. And back to our mission is about empowering the end human being every single day so that they can live, healthier, happier, longer lives. And so our idea around AI is precisely there. This idea of the infinite care team. Over time, there will be more things that software and AI can do to help you be your best and your best advocate, and will help you, access the experts and the clinicians when and if you need them. But the infinite care team can do administrative things for you. It can do things that frankly were administrative and took time away from clinicians. It
Right.
can do preventative stuff. Like, in Ontario, it really only preventative things you get told about happen when you're like 45 as a woman or when you're 50 as a man or man and woman and you get the colonoscopy letter. Congratulations.
Yep.
You need to go get a colonoscopy and your happy birthday. We can do all that stuff with technology way better. And you don't have to print out letters and all of that. It's just going to be done way faster. So the infinite care team is this powerful idea. It's not all about today and taking jobs away or anything like that. It's all about this is capability that's going to get better over time. We're going to empower people with it. It's going to help people get care sooner and in a way that is meaningful for them and helpful for them. And sometimes it'll mean we gotta go to a clinician or a hospital, but it'll avoid the waste, right? Like when I walk into an ER, what I see all the time is about 50% of the cases don't need to be there. Uh, they're people that are like severity Cap 5 or 4, and they should be, somewhere else. Technology can help, and the infinite care team can help, and over time it will get better. And the guardrail in our orchestration and our sort of agentic AI is about quality and safety and security and abiding by the standards that we all deem, and organizations like the medical associations of different provinces and states that they deem as safe. And that's the throttle, right? So we've got capability. It expands capacity. It helps people get care sooner, but we're not going to be unsafe. We're going to have these guardrails that kind of help us manage this over time.
Yeah, no, I think that it's important that there are guardrails. And of course, I'm sure you get these questions all the time. And again, just even speaking to the infinite care team, I know I have a variety of different people that listen. And I know that I think getting to the point where we are in healthcare now, that how can we not involve other care members of the team, right? And it's a sticky conversation, and some people get really upset and offended. And it's like, at the end of the day, I think we all have the same goal, right? The goal is more people are seen, we're more efficient, and we see better healthcare outcomes. Like, that is the goal that we're all marching to. But it's also getting people to understand and wrap their minds around that what we're currently doing is not working. And we have to use technology and various other members of the team to kind of fill in those gaps. I agree with you. I know some people might be a little bit angry about that conversation, but that's fine. Too bad. You talked a little bit about, we touched on the infinite care team, and you talked about some of the agentic AI tools in terms of like how you keep people, how you make sure that there's quality improvement. Let's talk about the trust gap. How do you get people on board? What do you say to the naysayers who are saying, no, this is not going to work for me?
Baby steps. Baby steps, right? How do you earn trust? You
Yes.
take a step and see that you're still on solid ground, and the step is what you thought it was. And then if that is the case, you may take another step. So, this is not about unleashing technology for the sake of technology. All right. Come
Right.
back to like, we have a real problem. And, as someone who is now in his 50s, I'm like, what's this going to look like for me?
Right.
Until
Yep.
you
We're
turn
going to be the
50,
end users.
you don't ever really think about that. But then I've been thinking about that. I'm like, what's this going to look like for me? And I'm not the most expert of experts, but I have been doing this for now 11 years. And I will tell you that my view definitively is, if we don't change at the system level, it will be worse for me than it was for my parents. And it is not the fault of the clinician or like my cousin who's a surgeon at Toronto General who does amazing. We are so grateful that we have these incredible clinicians, but it's the system that is failing. And so that's where I think, okay, this is a problem that is of the utmost importance from an economy standpoint. I mean, this is a drag on the national economy that, this is not working to the degree that we need it. So it's like a top 3 priority, top 5 priority in the country. It's my top priority. And my answer to the trust gap is baby steps. And we do everything with the end human, the end person in mind: safety, security, privacy, audit, compliance. All of that is, we have a trust center that's pretty important to how we do business. And there's education that has to come with that, right? How does this work exactly? Where did this come from? This recommendation. So explaining how recommendations come about and what's next for me, but ultimately delivering on these baby steps. I think that is really the thing to focus on.
Yeah, I think you're right. I think, we don't want people thinking it's like Skynet. Every once in a while, I have conversations with some people and they're just like, oh no, that's going to be this. And it's like, okay, well, let's talk about realistically what's happening. And I think you're right. These baby steps and these conversations are going to be very helpful for people to truly understand what's happening. And then of course, I think people should have a curious mind and always to dig and ask questions. That's the type of person I am. And I think that's fine too. And I also think that, in terms of that trust fall and making sure that people are aware of what's happening is that health equity piece. I'm always going to throw that out there because I do know, again, in healthcare, when I worked in quality improvement, we do see disparities. We do see those gaps, whether it's, folks who are precariously housed or, they come from a different ethnic background or, disability, that we make sure that whatever we're creating, that we always keep those folks in mind as well and make sure that they're involved in the process when we're building. I want to go back to one thing. And actually, maybe it's not going back because I think you touched on it, the digital front door. So let's go back to that statement Carly made at the Canada Club about opening up that new ED. It still sticks with me to this day because I think it's true that if in, 10 years when that new hospital is built, we do nothing and we open the door, it'll be more full. Just like what you said, right? Many people see League as the digital front door to healthcare. So looking 5 to 10 years down the line, we want to move away from this. Like you said, we only see proactive care with, that letter, doing a colonoscopy. For me, it's, mammogram screening. How do we move from this kind of proactive orchestration to where we are actually innovating and we're doing things that is preventative? How do you see League evolving to support long-term complex management of health that happens between our doctor's visits?
Yeah. So, I mean, at a company level, I would say, I started with zero healthcare knowledge or background or expertise, definitely a little bit higher today, 11 years later. But a lot of what we have done to get, our reach to 70 million and soon 100 million and beyond, I think of as infrastructure and, kind of laying the foundation to engage people at a much higher rate and start to get them, take care of administrative tasks, now start to get them with better access and navigation to care, get them on care journeys that are personalized. I think of that as foundation and plumbing, in connection into the system. But increasingly, we are becoming more clinical and care outcomes oriented. Engagement is important, and users or people using platforms powered by League is important. But increasingly, we think about high value actions and high value engagement. And value meaning, what does it mean to your health? What does it mean to your pocketbook or to your time, to your family? Increasingly, those high value actions are more clinical. And so, one of the examples that you mentioned, Carly, and we've been working with her team and leaders like her across the country, they've got people that are coming to their ERs that weren't planning on being there when they woke up that morning.
Yeah.
And unfortunately, many of them just don't have anywhere else to go. And sometimes they just don't know. So spending 5 hours or 3 or 2, the average wait time I saw the other day was 2.5, which was, pretty good compared to a lot of places, to then get brought into the ER, get triaged, and then eventually see a doc or a nurse and get a question answered. That whole exchange could be 5 hours.
Yeah.
It touched a lot of people, took up time, space, energy, money, other care advocates' time, and it didn't need to happen, right? We could have reached that person before they ever made it or thought that they should go in. And so increasingly, like I look at that and I say, that opportunity of just helping people where they are at home or wherever they are throughout their day with their family as an opportunity that will take significant load off the system. And whether it is a chronic care program or a post-acute care like cardiovascular program from UHN, these are various programs that can be modernized and ultimately people can get care where they are and they don't need to be going in. And frankly, they can get prevention. Like, the great example that often comes up is, the elderly grandmother that lives alone who's on a water pill and she needs an adjustment. She doesn't know. She's just not feeling well. She can't get a doctor's appointment. If her last resort or next resort is the ER, it may be already too late, right?
Mm.
Unfortunately, what often happens is you get into congestive heart failure and it could have been avoided by just having access and getting an adjustment in her diuretic. And the rest of the story could be different, very different for our family. So enabling this idea of an infinite care team that is working on your behalf 24/7, it knows you, it's helping you with prevention, it's helping you get access, it's helping you get access where is easiest for you, maybe an Uber or a taxi ride or a bus ride there as well. Because if that's all it takes, we should be spending that money to support that person to get, or that elderly person to get to care, because the alternative is way worse and way more costly and way more difficult. So I think this kind of technology and solution that we bring is essential, not only to the trilliums and what Carly was talking about, but really all of our hospitals and care centers across the country. We need to make solutions like this come to life. Otherwise, and I mentioned I walked through an ER yesterday and having been, a son, experiencing a parent getting hallway medicine, you know what it's like. Delirium sets in. Like, it is terrible. It is terrible. Spend tens of billions of dollars in building new hospitals, but if all we're getting is more hallway medicine, that is not what we deserve. So we need to do better, and I'm very happy that we have kind of a solution there to help.
Yeah, no, I'm looking forward to seeing kind of how this continues to transpire. I am transfixed to understand and see how we can improve, particularly emergency medicine and emergency care. Because again, emergency is like it's the doorway, it's the entryway, right? That's where a lot of the bottlenecks can start happening again when a patient needs to even just move up into an acute care situation or a bed that we really need to make sure that the emergency departments use for emergencies and leverage whatever tools that we have to ensure that we can continue to support patients and families in their communities and that they have an awareness. I think health literacy will be another piece to that, where people know maybe this is maybe not the most appropriate place to go. Maybe the system says, hey, this is where you can see this, instead of going to, the emergency department. I think that is going to be the future of healthcare, where people can really have an empowerment in terms of their health, and maybe even come to the emergency department with a differential diagnosis of saying, hey, these are all the different things that have been happening with me. Here are my labs that I've inputted.
You and I have talked about that, right? Like, that's coming. It's imminent. We're going to do that. Having not the random, perhaps ill-informed or ill-interpreted, ChatGPT differential diagnosis, but maybe one that's a bit better, that's connected to your data, but that you have and that guides you as maybe not, I'm not an expert. You're not, you're more expert than me, but helps the individual ask the right questions, which, as you know, in times of duress, it's tough to know what to ask, or tough to bring up that little piece of information that I forgot, but would be super useful in the moment. And, unfortunately, when many of us go to a hospital, we're not in the system, so to speak, right? So they're doing intake on the fly, and under duress, it's never perfect and stuff can get missed, and, unfortunate things happen. So we're all going to be empowered with greater tools. And I mean, that you walk into the league's office, that is on the front door and on the wall. We're here to empower people with their health every day. And I think it's never been more important.
Yeah, no, I love that. And I think that is going to be the direction. And I really hope for anybody out there, and that's kind of the work that I do too, that, when you're walking into healthcare, that it is supposed to be a collaboration. It is supposed to be a partnership. It's not supposed to be a dictatorship by any means. And I think that we need to transform it, that it does become a partnership, and that people do feel that they have that knowledge that they could say, here's a question that I didn't even think of asking. And this is what supported me to get there. And I'm looking with hope towards the future in terms of how people may feel more empowerment with the tools and the type of work that you're doing at League. So I see the time. So before we go, is there anything that we didn't touch on today that you'd like to throw out there?
I'll throw out some hope, because why not?
Yes.
We're talking about hard problems, and very important problems. And, it's easy when you get into those discussions to feel a little frustrated. And certainly if you've been through one of these experiences, it's hard not to be, and hard not to get to a place of frustration or hopelessness. But I will say this: these solutions to the problems that we have, they're not going to come from some alien spaceship that will arrive on the planet and share the future with us all. They're happening. They exist. They're happening around the world. And we're a part of doing that. The irony is, like, many of our great technology companies in this country, and this probably goes beyond technology, but they tend to find their footing and their first customers and their first demonstration and real results not here. And that's a problem for another discussion on another day. Yep. We're doing great work in Australia, in New Zealand, across the US. There's great examples in Singapore and Denmark and Saudi, in the UK. The solutions that will help us, they already exist, and we're getting better all the time. And with AI, we'll only get better faster. What this takes is for change is really leadership. It just takes leadership to say, that's where we're going. No excuses. We're going to solve this problem or these sets of problems. And I know there's not enough money, and I know there's not enough nurses, enough doctors, but we're going to solve this problem because we have no choice. I was with the head of the Mossad in Israel 12 years ago, and I asked a question of I knew nothing. I was just there as a visitor. And he said this line, he's like, because we have no choice. Necessity is the father and mother of invention. There is hope. There are solutions out there. Great Canadian companies like League, Point Click Care is another example. We've built these solutions and they're deployed. I mean, 70 million people is nothing to sneeze at. And we want to bring them here in Canada and work with our great healthcare clinicians and leaders to make this a reality for Canadians. I believe it's coming. It's going to happen. And there's a lot of hope.
Yeah, no, I think that's a great point to leave on. And actually, a question did just pop into my mind. Do you have a nurse on your team?
We have plenty. And over the years, we've had plenty of nurses.
Excellent.
And, we create all kinds of content that we're required to have clinically vetted and certified according to various standards bodies. So we work with nurses and clinicians all the time.
Excellent. I'll point some nurses in your direction then.
Yeah, that's pretty big.
Absolutely. So with that, thank you so much, Mike, for coming on the Gritty Nurse podcast and sharing your knowledge with me. I'm sure we'll be connected and we'll have many more conversations, but it was a pleasure. And I think, again, this is a conversation that we have to continue to have. And again, I am empowered by the fact that there are people doing this work. And again, just that last point, just that other places are doing this, like, let's make sure that we are sharers of knowledge, right? Like, we don't have to reinvent the wheel. If there are places that are doing this great work, we should be borrowing and really taking some of that innovation and bringing it home. So thank you so much for coming on, and it was a pleasure.
Thanks, Amie. I love what you're doing with this podcast, and keep spreading the word.
Will do. Thank you so much. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.